Let's do mental health now, because the Mental Health Authority has described the state of the mental health hospitals as one that is not of its best in the country. According to the Mental Health Authority, the 3 mental health institutions in Ghana are now dilapidated and lacks renovation, therefore affecting mental health care delivery. Speaking to JoyNews at a seminar to mark World Mental Health Day on the theme, the state of mental health in Ghana, realigning resource allocation, Deputy Director of the Mental Health Authority, Dr. Caroline Emisa, encouraged hospitals in the community to have a mental health department to prevent people from traveling to the already existing ones to make it accessible to everyone. All right, so we'll try and get you that sound, but joining me for a conversation in the studio is Dr. Ramata Saidu. She's resident in psychiatry at the Accra Psychiatric Hospital. Raphael Bokba is a senior nursing officer. I'm grateful that both of you made it to the studio. Let me start with you, ladies first, they say. Okay. Ramata, tell me the situation of our mental health, or the status of our mental health care delivery in Ghana, just like Dr. Caroline Emisa is lamenting.
Okay, so just like Dr. Emisa said, it's actually not in a very good state. We have, as it stands now, there are only 3 main psychiatric hospitals in this country. So we have the Accra Psychiatric Hospital, Pantine Hospital, and then the Ankafo Psychiatric Hospital. And if we realize these hospitals are all in the southern belt of the country, leaving the northern and the middle belt without a psychiatric hospital. So this makes it very difficult for people or persons suffering from mental illnesses to actually access these psychiatric facilities that is far away from them. And even the conditions of the hospitals, like she said, are not in very good conditions, quite dilapidated, and some good work would be required to fix them up.
Let's talk about this year's mental health celebration. And I see that you're trying to bring on board all the issues affecting mental health, not only neglect for mental health people, but you're also looking at resources to deal with these mental health people. So the theme for this year's celebration is what? Realigning. What's the theme?
The theme this year is the mental health in an unequal world.
Okay.
Yes, which was agreed upon locally and globally by the World Health Organization.
Okay.
And it actually focuses on the fact that when it comes to people suffering with mental health, they are usually the vulnerable group, and looking at how unequal the world is. So the first thing is accessibility. So people don't have access to mental health care services, be it in a psychiatric facility or even a general facility. Like she said, in the communities, all hospitals try and have a unit. Okay. And then also talks about stigma and discrimination, isn't it? So we have them being mostly stigmatized, mostly discriminated against in the communities, in the workplaces, in the schools, and all other institutions you can come across. And then also when it comes to even sharing of resources, it is usually it's usually disproportionate. So if you have the healthcare budgets, which is worldwide, but if I zoom into Ghana, the budgets that mental health usually receives is very, very little and cannot actually cater for what needs to be done. So we are focusing on the unequal aspects of it.
The unequal distribution of resources in dealing with this. And this is a very central part. But before that, let me ask you, where are we with trying to reduce stigma for mental health patients? Okay,
so I would like to start with just a bit of a history, how psychiatry came about in Ghana with our facilities. And for the record, we know that the Accra Psychiatric Hospital was the first facility to be opened in the year 1906. Started operations in the 1907, and the initial plan was for 200 patients, and there were 16 attendants who were actually taking care of these patients. Currently, it has expanded to about 600 bed capacity. And then the patients, currently, they are just a little over 300 patients. Now, I think over the years, there have been some strides in actually upgrading psychiatry. We didn't used to have a mental health authority. Now we have an authority that solely takes care of mental health issues in the country. Most of the regional hospitals, district hospitals, do not have what you call psychiatric units as part of the facilities or the hospitals. So I think we have made some strides. But then again, these are very, very little strides. They are not very significant. We think more can be done. We think that a lot of efforts can be put in. Again, coming from the Accra Psychiatric Hospital, that we normally term as the headquarters of psychiatry in the country, I want to again add that a lot more can be done in terms of infrastructure. For those who have been there before, know that the conditions there are not really very good, though improved. Over the last 10 years, there have been some major innovations in some of the units, but I think that a lot more can be done. We need a lot more commitment, a lot more investment in the sector of mental health. It's very, very important. Mental health is total health.
So, Dr. Saidu, let me find out from you. This is something that your deputy director is saying that, I mean, she's asking for sort of decentralizing access to healthcare, mental health care. And so she wants, I mean, various hospitals to have units so people, that the main hospital will not be choked. But is this a conversation that you've had with the Ministry of Health, for instance, the Ghana Health Service? I mean, is this something that you've done to help deal with this situation?
Oh yes, it's actually gone past conversations.
Okay.
So we have enrolled a lot of it in most of the general facilities. We do have, who she is my boss, Dr. Amabwedu, who is with the Ghana Health Service, was previously with Accra Psychiatric Hospital. She's doing an amazing job. Okay. So she is the Deputy Director of Mental Health Services with Ghana Health Service. And we've gone on trainings to train general practitioners on basic or minimum skills when it comes to mental health care. And the aim of decentralizing is also supposed to help with the stigma and the discrimination, so that people don't feel they have to come to a psychiatric hospital for care. If I can go to a polyclinic for care for malaria, hypertension, why can't I walk in for mental health care services? And it increases the accessibility as well. So this is past the conversations. It's something we are actually enrolling. But yes, there are certain limitations, but we hope to go past and make sure we enroll it nationwide. Okay.
So, I mean, speaking right now, what is the single most difficult thing facing mental health care delivery in Ghana? You want to address that for me?
Okay. So I will say it's funding. The policies are in place, all right. I mean, the plans are there. What to do is actually there on paper, but it's the funding. We have a mental health staff, a few of them actually. We need actually a lot of them. When it comes to psychiatrists, we don't have a lot of psychiatrists in Ghana. There are few. Dr. Rama can attest to that. Mental health nurses, yes, they are there, but again, where to work? Most of the facilities have not been upgraded to, let me say, polyclinic status or regional facilities or district facilities level. And all these ones need funding. So funding is a main thing. I believe that there are other issues that we can look at in terms of the stigma, the discrimination, which is, I mean, against both the client and then the staff also. It's not just against the clients. The staff also face the discrimination. But the main thing I want to actually emphasize is the funding for mental health activities or programs in the country. We need to see a lot more funding, both infrastructure, both human resource and everything. We need a lot more funding in these areas.
Okay, so let me chip in this one. Some time ago, the Psychiatric Association of Ghana did a research, and it brought on board, I mean, people working in working environments, the people who you find there who also have some mental issues, as they say. Is this something that you deal with every day? That it's not people who just go naked outside, who are just mad people who have mental issues, but they're people who are also even found in the working environment, and because of one thing or the other, they also have mental issues. I mean, do you face some of these cases at the hospitals?
Yes. So there's one big misconception where people think that the only kind of cases we see are the ones on the streets who go naked and who look all scruffy and dirty and unkempt. But when it comes to the field of psychiatry or the field of mental health, there are a myriad of cases or diagnoses that we have. From the popular one, which is depression, anxiety disorder, then we have bipolar, we have sleep disorders, we have seizure disorders, even though it's not technically our field, but people still come. We have personality disorders, we have the big old schizophrenia. there are a lot of things that we attend to, sexual disorders and all that.
Okay.
So we do see...
Sexual disorders are also mental cases?
Yes, we do have...
Really?
Yes, we do have a category under the diagnostic manual that deals with that as well. So there's a lot of things that we attend to, not just people, quote unquote, on the streets. So the average person like you and I who has any challenge with their mental health, they cannot cope with the normal stresses of life, and they seem not to be able to contribute to society the way they would want to. So long as you are distressed and you're functioning in any way, you can always seek help. You don't necessarily have to look like those on the streets.
So what would it take to deal with all these issues that we have identified as affecting mental health delivery in Ghana? You talk about stigma, you talk about discrimination, and above all, you talk about funding.
Yeah. So with the funding, like my colleague said, it goes beyond just the two of us. It goes beyond, it's usually stakeholders and petitioning government.
What has been the response from government?
That would be difficult for me to see. I think that would have to come from someone higher than me. But from where we sit, it hasn't been as we would expect. So I know that although they do give us some money, it usually would come late. And even when it does, it's not enough. Because first of all, mental health services are technically supposed to be free in this country. So if you're not providing us with the funding, then how exactly are we supposed to support the care of the persons that suffer from mental illnesses? The Accra Psychiatric Hospital that I can speak for has quite a number of people with them as vagrants, isn't it? People who have been there for years and don't have families or cannot recall where they live. We have to clothe them, we have to feed them, we have to give them medications, and if they have to go see a doctor outside the facility, we have to pay for. Yeah, so if we are not getting the needed reimbursement and money to care for all these people, how do we expect to deliver any quality care at all in the first place? So funding is a problem. I know they do. Well, they do, but I don't think it's enough.
Specifically, where is the challenge? Is it distribution of drugs? I mean, money for upkeep for the mental patients? Where exactly are the loopholes?
It would be difficult to say. It's everywhere, from A to Z.
Medication, feeding, clothing, it's everywhere.
It's everywhere.
It's everywhere.
So what really do you want? I mean, this is an opportunity for you to reach out to the people who matter in resolving some of these issues. It's World Mental Health Day. What do you want from government?
So we want to see a lot more commitment. We know the challenges that government face. Yes, we understand. But we want to see a lot more commitment. We want to see a constant supply of medications to deal with our psychiatric patients or conditions. We need a lot more of that. In terms of money for upkeep, feeding, clothing, we need a lot more funding. What is coming, as you rightly said, something is coming, but we think it can be better. There's still more can be done. Yes, it can be better.
But even as we celebrate the day, there's also been a conscious effort to create awareness as to how to treat mental patients. I mean, how we should stop the stigma, discrimination, and what have you. I mean, what message do you have for the people out there, Dr. Sadie?
Okay, so the message I have is that it's okay not to be okay. I think it's difficult for people to ask for help, particularly in a society that considers mental health to be an abomination, to be a spiritual attack, and for all sorts of reasons. But there's treatments, there's medications, there's help out there. It doesn't have to be even just pills. We have the psychologists, clinical psychologists who do their own work as well. So there's help available to all. If you have a challenge or you have a difficulty coming to the psychiatric hospital, I always suggest that people go to the nearby clinic and have any other doctor assess them. They can do what they can do within their limits or within their skill set. If they need you to see a psychiatrist, then they'll refer you to see a more specialized person in the facility. But the help is available. You don't need to suffer it alone.
Is this the more reason you want units, psychiatric units created in hospitals? Because I tell you, people don't want to be seen walking to the psychiatric hospital, for instance, the Accra Psychiatric Hospital, because everybody will think that, okay, I saw her or him, she's mad or something like that. Is that the more reason why we need units in our hospitals?
It's one of the goals, but the main way to combat stigma, is to decentralize the care, like you're saying, so that not everybody has to come to psychiatric hospital. Some can go to other facilities. Assuming, let's say, I have hypertension and I go to Ridge Hospital for my antihypertensives, and I have depression and I go to Accra Psychiatric Hospital for my medication. So if I go here, Ridge on monthly basis, I go to Accra Psychiatric Hospital on monthly basis. That is me taking 2 days out of my month to spend the whole day in 2 different facilities. Why should that be the case? I should be able to get all that I need in one facility. And then when it happens that way too, it also combats the stigma on the guards of staff. That is non-psychiatric staff. Feeling like, oh, this is mental, go to psychiatric hospital. No, now you offer the services within your facility. You are trying to treat the patients, and you're trying to look beyond the stigma to make people more comfortable to have access to
Well, this is a conversation that we keep having until we see that, I mean, there's sanity in the system, and we see that the stigma and discrimination and all the funding issues are dealt with. Thank you so much, ladies and gentlemen, for coming. Dr. Ramata Seidu, she's a resident in psychiatry at the Accra Psychiatric Hospital. Raphael Bokma,
yes.
a senior nursing officer at the Accra Psychiatric Hospital.
Yes.
I'm grateful for your time.